following is a candidate forum conducted by the Cold Spring Area Chamber of Commerce on Thursday, October 12th. Due to technical difficulties, viewers will witness some audio interference in parts of this program. We apologize for any inconvenience this may cause for either the candidates or for you, the listening audience.
What should be the position of the legislature in making health care affordable and accessible for everyone?
When the issue of healthcare comes up, I like to simplify it into two sides or two separate issues, and one is the quality of healthcare, and one is the cost of healthcare. As a state, we need to make sure that every one of us and every one of our family members and anybody in this area, when they walk into that Painesville hospital or they walk into that St. Cloud hospital, they're getting the best qualified care that we can provide them. As a state, we need to make sure of that. We need to improve upon good numbers that we have. Minnesota is the healthiest state. A little over 90% of Minnesotans are insured. We need to work on getting the other 10% insured. New technology, new machines, and advanced testing, and advanced technology is going to create greater costs, thus creating greater costs in health insurance. We need to, and door knocking over the last 6 months, I guess the greatest concern people have given me is the concern about health insurance costs. We need to do all we can to reduce those costs and look at ways we can reduce those costs. Businesses such as the Blue Heron should have the ability to pool together with other businesses to spread those costs out over a larger group of people. Right now, in Minnesota, we should have the ability, like Great Blue Heron and Cold Spring Bakery, to pool together to reduce those costs over a greater number of people, not just 5. We need to provide incentives to have medical savings accounts, to empower consumers in choices and the wise decisions they need to make regarding their own health care. Quality and affordable health care is a main concern and a top issue for most people. Health care has a lot of issues and minimal solutions thus far, but if elected, I promise to go to the Capitol and find all ways we can reduce those concerns and provide more solutions.
I think the healthcare issue is a prime example of how partisanship has really led to an absolutely ineffective approach to addressing our healthcare needs. You're not going to see one candidate, I think, throughout the state of Minnesota, Republican or Democrat, conservative or liberal, moderate or independent, that doesn't talk about healthcare. We all talk about it, why don't we get anything done? And I think it's because of partisanship. We talk about wanting to pool together businesses. We've attempted to do that, and House leadership has ruled it out of order and hasn't allowed us to even debate it onto the House floor. There is no one simple solution when it comes to healthcare. It's a complex issue that demands complex ideas. All the ideas out there are good, and we need to build upon them. And we can't sit there and demonize each other for political reasons. We need to make sure that we have health savings accounts that take into account maybe younger families, individuals who can handle the health savings accounts, high deductible plans. We need to make sure that we have preventative health care that's instituted that allows people to go into the doctor and get preventative health care measures which save us tremendously in the long term. And we need to make sure that we implement systems, not only implement systems, but demand new systems from our private health care providers to bring more efficiency. When the St. Cloud Hospital has 11 people doing coding simply for Blue Cross and Blue Shield, yet they only have 6 people doing coding for Medicare, and the majority of their client base uses Medicare programs, we are very inefficient in our systems. We need to have medical or electronic medical records. We also need to make sure where are our priorities. We're a state that demands that every single licensed driver in Minnesota have car insurance. Why can't our children have health insurance? One of the most successful programs that we've seen in the entire nation that has saved us the most money, and this surprised me when I heard this, was food stamps. Food stamps saved the government one of the most amount of money of any program. It's because it made sure our kids were healthy and had a good diet. If we make sure our kids are healthy and are entering into our school systems ready for school, healthy, and their minds focused on education, we save money in the long run. We need to make sure that we have that there. It needs to be a collaborative approach. A single-payer system, a universal healthcare system, is not the single answer. Private paid health insurance, health savings accounts, is not the single answer. We also need to make sure that there's flexibility within the system and that mandates don't take too much of a toll. With my business, if I were to hire an employee, a single male, why the heck would I have to have maternity care on the health care plan? That's a mandate that doesn't make sense in some instances, so we need to make sure that flexibility is also there.